Hello, friends. Welcome to the Medic World Study with Dr. Mahi. Today, we are going to start a series on medical triads. So, our first triad is Virchow's triad. It is characterized by hypercoagulability, endothelial injury, and stasis. Now, clinical significance. This triad is essential for understanding thrombosis risk factors, including those leading to myocardial infarction and stroke. It underscores the importance of managing these factors to prevent cardiovascular events. Now, the next triad is Cushing's triad. It is characterized by hypertension, bradycardia, and irregular respiration. We can learn it by three vital signs. First is BP, second is heart rate. Third is respiratory rate. BP is high. BP means blood pressure. Heart rate is low and respiratory rate is irregular. Now let's understand the clinical significance of this triad. It indicates the increased intracranial pressure which can result from brain injuries, tumors, or any other condition affecting the brain function. Now, prompt recognition and management of increased intracranial pressure are crucial to prevent the further neurological damage. So, it is an important triad. Let's move towards other triad, that is Beck's triad. It is characterized by hypotension, distended neck veins, and muffled heart sound. What is the clinical significance? It is diagnostic of a condition called cardiac tamponade. What is a cardiac tamponade? It is a condition where fluid is accumulated in the pericardium, compressing the heart, reducing its ability to pump blood effectively. This triad helps in rapid identification and intervention of this life-threatening condition, that is cardiac tamponade, where a fluid is accumulated in the pericardium. Just imagine this is our heart. The shape of heart is not like this. This is our heart and which is covered by pericardium. There is a fluid in the pericardium. When the amount of this fluid is raised too much, that it starts compressing the heart from all the sides and it affects the ability of heart to pump blood outside the heart. Now, next triad, that is the Hutchinson's triad. It is characterized by interstitial keratitis, dental abnormalities like mulberry molars and notched incisors, and eighth nerve deafness, that is sensory neural hearing loss. It's suggestive of a condition called congenital syphilis, highlighting the neurological impact of syphilis when transmitted from mother to child. Early diagnosis and treatment can mitigate long-term neurological consequences. Now, this triad can be asked in the exams with the help of images. So, we have to identify the images too. So, let's identify the images. The first image is of interstitial keratitis affecting the eyes. The second image is of notched incisors, that is one of the dental abnormalities, and the image is of mulberry molars, which is also a dental abnormality. Now, next triad, that is Sarko's triad. It is characterized by jaundice, fever with chills, and right upper quadrant pain. Its clinical significance. It is helpful in diagnosing a condition called cholangitis. Cholangitis means itis means infection and cholange means bile ducts. So it is a condition where infection of bile ducts is present. This triad is critical for identifying patients who may require urgent biliary drainage alongside antibiotic therapy. So the last triad for today is the Staines triad. It is characterized by gallstones, hiatal hernia, and diverticulosis of the colon. Now, the clinical significance. Though it is not indicative of a single disease, the presence of these conditions in a patient may guide the gastroenterologist in managing complex cases where these conditions coexist, affecting the treatment approaches and prognostications. That's all for today. Thank you so much.